Out of all the areas in the face that is quite challenging to treat with Botox, I'll tell you, forehead is, I would say, a hit or miss. That's why it's important to go to a very experienced injector, because injecting Botox is not just a matter of raising your brow or making expressions. So these are two considerations that I look at whenever I see a patient when it comes to injecting Botox. Remember that I just say Botox collectively, but neuromodulators, there are different brands: Botox, Xeomin, Jeuveau, and Daxxify. What they do is to modulate the muscle that's contributing to the formation of wrinkles. Now, whenever we treat the forehead, remember that you also have to treat the frown in the most ideal scenario in order to not only give you the best and optimal natural looking results. Consider your forehead as just the ceiling of your house, and these are the pillars. The pillars support the ceiling of your house, so you only treat this, what happens? It drops because you don't have a support. Okay, so I hope that makes sense to you. Going back, what are the considerations? So look at the size of the forehead: large, medium, or small. So for a smaller forehead, you don't really have a lot of elbow room when it comes to distributing a Botox, so that's why you have to be very careful not to drop the brows. Now, in my case, medium size, we have a little bit more space there, but also consider that while increasing the dose could potentially increase the longevity of Botox, but you're also crossing the thin line between looking frozen and looking fake. I would rather stay conservative when it comes to injecting Botox unless somebody has real, like, full on and very active dynamic wrinkles. On average, about 12-15. Very rare that I give 20 units on the forehead first time patients. Yeah, so that's that. Number two is look at the lead laxity of your patients, especially my age group, Gen X and above. I'm a perfect example. I'm starting to hoot already. What used to be before, where you can create a nice cat eye, now the cat eye is disappearing. That's why I'm not doing that myself. But jokes aside, so you have to consider, okay, because if you overdo the forehead or you are way too low, it's gonna add to the heavy feeling of my eyelids, or our eyelids in general. That's why there's always a compromise whenever we treat the forehead, especially in the case of those that are already starting to see lid laxity. Unless it's a litosis, which is a different topic that we will talk about in another video, the heavy feeling that you're experiencing a few days to about 2 weeks while the product or while Botox starts to kick in, note that it's not going to be like that for the next 3 or 4 months. I tell patients at the most possibly 3rd or 4th week, but it will start to get better and loosen up.